Hello everyone present here. This is Apurva from Mom's Belief. I hope you all are safe and doing well. Today we have with us Dr. Ravi Kumar, who is working as a consultant pediatric neurologist at Aster CMI Hospital, Bangalore. He has spent over 14 years in training and working in the UK. He has worked as a pediatric consultant at the Royal Alexandra Children's Hospital in Brinton, United Kingdom. He also undertook specialist training in childhood epilepsy and neurology in reputed teaching hospitals in London. His special area of expertise is in epilepsy management, including ketogenic diet and vagal nerve stimulation. Dr. Ravi Kumar is a faculty member for BPNA, that is British Pediatric Neurology Association, and teaches on pediatric epilepsy training and childhood headache training program. He is a member of Association of Child Neurology in India and has a faculty in various epilepsy-related training programs. Today, Dr. Ravi Kumar is going to tell us about epilepsy. A very warm welcome, doctor. Thank you for joining with us today. Now, without any further ado, let's start the session. Over to you, sir.
Thank you very much. Hi, good evening, everyone, and thank you very much for joining today. I know it's a Saturday evening and looking forward for a long weekend for most of you have. I'm Dr. Ravi Kumar, as Apurva has kindly introduced. I'm a pediatric neurologist. Today, my talk is about epilepsy, and I'm going to give you a very general talk on epilepsy, not just on pediatrics as a whole. And I thank Mom's Belief team, Mr. Rajesh Uttam Jain, for giving me this opportunity to engage with this august audience. So without much delay, let me start off. Rajesh, next slide. Next slide. I work in Bangalore. I'm sure the audience here is across the country. I work in Aster hospitals. We have 3 hospitals in Bangalore and available at all 2 of them. The objective today is to talk about epilepsy, but most importantly, to have an open question and answer session with you all. Because I'm pretty sure in these days, if you Google, you will be able to find many information which we doctors have access to. But you may not have all the opportunity to ask your questions which may be bothering you. So today I'm going to make a sincere effort to answer those queries. Okay, next question, next slide, please. So what is epilepsy? Epilepsy is mainly a disorder of the brain. I think somebody has raised a hand. I'll come back to you, Ms. Bharti. Disorder of brain affects all age groups, and it is very common in the first decade and the last decade of life. And it doesn't restrict itself to any particular area, region, religion, or countries. So it's one of the very common conditions which we see in neurological problems. Among all the disorders, what we see in neurology, epilepsy is the commonest. Is there a question from Bharti, or is it by mistake? Hello?
Hello, Bharti, you can ask your question if you have any question.
Okay. She says,
Hello?
kindly unmute. Yeah, hi. Hi, I can hear you, Ms. Bharti.
हेलो
I can hear you. We can hear you.
हाँ जी सर, आपको आवाज आ रही है मेरी?
Yeah, I can hear you. सुन सकता हूँ, बताइए.
हाँ जी सर, आप पीडियाट्रिक न्यूरोलॉजिस्ट हैं. मेरा क्वेश्चन एपिलेप्सी से तो नहीं है, बट इसी से रिलेटेड है. मेरा बेटा 4 साल का है, उसको माइल्ड ऑटिज्म डॉक्टर ने बताया है. तो दिखने में तो बेटा मेरा हेल्दी फिट है, बट बैठता नहीं है एक जगह. तो ये कौन सा? हाँ, एक जगह टिककर नहीं बैठता, यानी उसको कुछ भी सिखाओ, कोई एक्टिविटीज, बाकी उसके सारे सिम्टम्स ऑटिज्म वाले हैं, जैसे स्पीच डिले हुआ या कम्युनिकेशन प्रॉब्लम, बट वो एक जगह बैठता नहीं है. तो मैंने डेवलपमेंट पीडियाट्रिशियन को दिखाया है, तो उनका कहना है कि इसको सेंसरी इश्यूज है. तो सर, बच्चे का ना बैठ पाना, ये कौन सा सेंसरी होता है, मतलब क्या रीजन होता है?
ओके मैम, एक मिनट. सॉरी, मैं पहले अभी एपिलेप्सी के बारे में डिस्कशन हो रहा है, सो ये बहुत इंपॉर्टेंट है कि हम एपिलेप्सी की टॉक कंप्लीट करें, उसके बाद लास्ट में आप सवाल पूछ सकते हैं, क्योंकि बहुत सारे लोग जो बैठ रहे हैं यहाँ और सुन रहे हैं वो एपिलेप्सी के बारे में सुनने के लिए यहाँ हैं। मैं आपका सवाल का जवाब लास्ट में दे सकता हूँ, ठीक है?
Okay.
Thank you, ma. Thank you. So, as I mentioned, epilepsy is a very common disorder in the neurological system. It can affect all the age groups, and we are concerned about pediatrics and adults as well, but common into extreme decades. Why? We will look into it. Next slide, please. See, in majority of the cases, the cause of epilepsy is not known. We call this idiopathic. Idiopathic meaning cause is unknown. But in children, one of the commonest reason is brain damage at the time of birth. It can be because of loss of oxygen, difficult delivery, or even low birth weight. The other commonest or less common causes is sometimes there is abnormal brain development. Means when the baby is being formed, the structure of the brain is not correct. It is not well formed. So that can also cause seizures. Head injury, very common cause. In India, I think especially in Bangalore, what we see, we have the maximum number of two-wheelers, and people refuse to wear helmets. Even though they have the helmets, they'll be carrying on the bike handles, but do not wear it. Commonest reason for epilepsy, they fall, they injure, they end up having epilepsy for the rest of their life. So it is very important to protect yourself. Stroke, very common in elderly population, hypertensive, diabetic, hypercholesterolemia, all this predisposes to stroke. Next commonest cause, meningitis. Once again, very common in children, as their immune system is not as mature as it matures with the age, and they're prone to serious infections like meningitis, encephalitis. What is meningitis? Meningitis means infection of the layers surrounding the brain. Brain is packed around with protective layers, and if the infection is restricted to that, that is called meningitis. Whereas if the infection enters directly into the brain, it is called encephalitis. What is neurocysticercosis? Neurocysticercosis is a condition where there are certain worms which enters into the brain and forms a cyst. And when the cyst is formed and well covered, it doesn't cause any problem most of the times. But when it dies, it releases toxic substances which irritates the brain and causes seizure. Now, as we know, technology is moving very fast, and we have been able to identify many genes that are responsible for seizure. They're called genetic syndromes. And finally, brain tumor. Whenever we have a child or an adult with a seizure, most of the times parents are worried about, is it a brain tumor? But in reality, the biggest issue with epilepsy is idiopathic. Means in 50% of the case, the cause is not known. I hope everybody can understand English. हो सके तो I'll briefly tell you in Hindi. Epilepsy की वजह क्या है? ये सबका पहला सवाल है. So हमें क्या देखना है? अगर आप 100 लोगों को लिया तो 50% लोगों में क्यों हुआ है और पता नहीं चलता. उसे हम medically बोलते हैं idiopathic. It's a Latin word which means unknown. So when you say unknown 50%, then what is the reason for seizure? See, every brain has billions and billions of neurons, and some of these neurons may fire or release electric signals in an abnormal fashion. So why it happens, we cannot explain in all the causes. There are some times where we can find a cause why this happens. For example, brain damage at birth, brain not developing properly, head injury, stroke. Stroke, I think in Hindi or any language, stroke everybody understands. Meningitis, यानी brain का layer का infection होना, encephalitis, brain का infection होना है, और neurocysticercosis एक condition है, एक worms होता है जो पेट में भी हो सकता है और दिमाग में भी जा सकता है, उसकी वजह से seizures हो सकता है. These the other few things is genetic syndromes, यानी what you call from birth. And finally, brain tumor. These are the commonest causes for seizures. Rajesh, next slide. So what are the symptoms? Seizure हुआ तो कैसे पता चलता है? See, सब लोगों को ऐसा इतना ही पता है कि जो टीवी में देखते हैं, हाथ पांव शेक होना, ड्रूलिंग, या हिंदी में क्या बोलते हैं मुझे पता नहीं, ऐसा ड्रूलिंग आना, उसको हम बोलते हैं सीजर। बट इन रियलिटी मेडिकल वर्ड बहुत सारे ऐसे चीजें होते हैं वो सीजर की वजह से होता है। There are many varieties of seizure, many symptoms, but generally people believe that only shaking of the limbs, salivation, loss of consciousness is seizure, but it is not the case. Jerking of movements of the arm or the legs is very common. Agreed. There are some types of seizures where the person is just staring. You might have heard of the name absence epilepsy. And there are some conditions where there is no shaking, but the arms and legs are stiff, like this, tight. No shaking, but just stiff. That is called tonic. And when you have tight and shaking like this, it is called tonic-clonic. So that is important to understand. This is a commonest type of seizure, but there are many other varieties. In some cases, you may see that the individual is just collapsing. There is no reason, just collapses. In such cases, that is also considered seizure, provided there is sufficient other evidence to support the diagnosis of epilepsy. Sometimes there is absence. In absence, the person may be just staring or is doing things but not responsive. And in addition, there may be some other movements, what we call automatisms, that is shaking of, blinking of eyelids, staring. Then there is something called automatisms. They start doing some movements with the hand, which are very fine, which the person who is doing doesn't know. So once again, to explain, सीजर यानी बहुत सारे वेराइटीज होता है। एक वेराइटी से दूसरा वेराइटी अलग हो सकता है, लेकिन जनरली लोगों का मानना है अगर वो बेहोश हो गया, ये सलेवेशन आ गया और ऐसा झटका हुआ तो उसको बोलते हैं एपिलेप्सी। बट लेकिन मेडिकल वर्ड में बहुत सारे वेराइटीज है, सो ये सब एपिलेप्सी हो सकता है। नेक्स्ट स्लाइड राजेश। सो एपिलेप्सी का डायग्नोसिस कैसा, how do we diagnose a condition of epilepsy? So first and foremost is the medical information. What exactly happened at that time? कैसा डायग्नोस करते हैं हम, पेरेंट्स से या पेशेंट से पूछना है कि क्या हुआ। जब आपको बोलता है, आपको लगता है कुछ प्रॉब्लम हुआ ना, क्या हुआ उस टाइम, वो डिटेल्ड इंफॉर्मेशन लेने से बहुत फायदा होता है। बहुत सारी केसेस में वो इंफॉर्मेशन से ही डायग्नोस होता है। As accurate information as possible will help you in an accurate diagnosis. Many times parents or patients panic, or they may not be able to understand what exactly happened. So the information may be very difficult to extract, but it will very helpful if you can meet some eyewitnesses who have witnessed the whole event, and they will be able to get the information. Secondly, neurological examination, blood test. Sometimes we may have to do something called CSF analysis. CSF analysis means there is a fluid surrounding the brain and within the brain that acts as a cushion, that acts as a draining system for the body to get rid of all the toxins, particularly from the brain. In addition, it also carries the nutrition. So it will show signs of infection. It will show signs of any chemical abnormalities which are responsible for the seizure. So it is very important to do this investigation in certain cases, not all. That's why I've written plus or minus. So जैसे बोला था, डायग्नोसिस कैसा होता है मेडिकल इंफॉर्मेशन से। दूसरा, पेशेंट को एग्जामिन करने के बाद कुछ ब्लड टेस्ट भी करना जरूरत है, क्योंकि कैल्शियम, मैग्नीशियम, विटामिन डी कम हुआ तो भी सीजर हो सकता है। So sometimes if there is low calcium, magnesium, vitamin D, that can also cause seizures. In addition, many electrolytes. कुछ कंडीशंस में CSF एनालिसिस करना पड़ता है। ये है ब्रेन का फ्लूइड जो ब्रेन के अंदर और ब्रेन के बाहर होता है। इस फ्लूइड का काम है न्यूट्रिशन पहुंचाना और क्लीन करना, ये ड्रेनेज सिस्टम जैसा है। सो उसको कभी कभी एग्जामिन करना पड़ता है कि कहाँ कोई एविडेंस हो इन्फेक्शन का या कोई अबनॉर्मलिटी हो कुछ केमिकल्स में, वो करना बहुत जरूरी है। Then the commonest investigation which we do in epilepsy is called EEG. EEG is called electroencephalogram. Electro means electrical, encephalo means brain, graph is the graph what we see. Just like you have ECG, heart का जो graph लेते हैं, उसी तरह brain का electroencephalogram. And finally, brain image or what you call brain scan. There are two types. One is CT scan and the other one is a MRI. We would always recommend a MRI scan, which is called magnetic resonance imaging. The reason why we suggest magnetic resonance imaging is it is safe. It does not carry any radiation. Secondly, it will give you very fine details. So it is very important for us to get the right investigation to get the right answer so that you can give the right treatment. So और एक बार repeat कर सकता हूँ क्योंकि ये slide बहुत important है. See, medical information. Epilepsy का diagnosis कैसा होता है? पहला information है medical information और the history. जब seizure हुआ, कौन था उसके साथ, उसका जो information आता है उसी तरह उसी की वजह से diagnosis का मदद होता है. So the clinical information what the person gives when the seizure happened is the most important thing. Nowadays, most of you carry a mobile phone. If you ever notice somebody had a seizure, please record it and give it to the family. Do not share on WhatsApp. It is not good. So give it to the family because many times when we see the video, what we pick up is much more different and much more variable than what the parents explain. So it is very important that if possible, please make a video record. So neurological examination to examine the child, blood test, CSF analysis, EEG and MRI. EEG or MRI, both important blood tests, both important investigation. EEG and MRI both are painless. It doesn't cause any harm to the child. We need to make sure we do in the right way and the right place and the right person investigates or reports the EEG. Pediatric EEGs are very challenging and it is very important that you seek the opinion of a pediatric neurologist or a pediatric epileptologist in the nearby towns where you are. MRI और CT मैंने बताया था बहुत सारे लोग CT कर देते हैं क्योंकि पैसा कम है और जल्दी काम हो जाता है लेकिन यहाँ काम जल्दी होना नहीं अभी काम है to get the right information जल्दी नहीं तुरंत से सही लेकिन ठीक से करना है. I think Mr. Shaheen Abdullah is asking, I missed what is CSF. So I'll repeat once again. CSF analysis is to study the fluid surrounding the brain. CSF, C is cerebro, that is once again a different term for brain. Spinal, the cerebral and spinal, both are surrounded by this fluid. F for fluid, cerebrospinal fluid. So this actually supplies the nutrition. It also clears the toxins from the brain. So if there is any information, we can always find out what is there so that the treatment can be tailor-made. Okay, I hope I think there are some questions here. Let me take it. Akanksha Saxena, madam, can you please unmute yourself and ask me the question?
Good evening, sir. So this is regarding because we're talking about diagnosis right now. So there are times that, people don't come to know that it was a seizure. So, when later on, I'm talking about maybe months later, years later. So if they get diagnosed again and, some educator or some, the counselor, somebody feels that there was something wrong somewhere down the line. That, some seizure had happened somewhere there. That's why their developmental or their learning output is not so good. So is it that later on, if we recommend that you get an MRI done or EEG done, so will the authenticity the same?
Yes, it will remain the same. In fact, so let's say that somebody is having let's say somebody is having epilepsy or seizure. And with time, you might not have realized, and eventually when you investigate, the findings will be more or less same. And there are some conditions, some epileptic condition, early treatment gives a very good outcome. If it is missed, it will cause a lot of other problems. So that may once again help you to identify. So investigations will not.
Brain damage will show. I mean, the impacted brain damage will show.
Will show.
Later on also, years later also.
Yes, absolutely.
Yeah, thank you so much. Thank you so much, Doctor.
Thank you. So there are two other questions. One is some Sanvi Kapoor. Respected sir, is there a relationship between epilepsy and autism? Autism is entirely a different thing. The only thing what is related or what we know about epilepsy and autism is children with autism are at a higher risk of developing epilepsy compared to general population. So I'll come back to it later to discuss about what is the incidence in the general population and children with autism. Then there is something called, somebody's asking, I can't see the name, Mr. It says, what is the MTS and FCD? Sometimes they say patient has MTS and FCD. Okay, so MTS is mesial temporal sclerosis. Mesial temporal sclerosis is a certain area of the brain which can get scarred if somebody has seizures again and again, especially if it is not treated. But sometimes a child is born with a scar in the mesial temporal lobe that itself can cause epilepsy. Got it? Is it clear? I don't know who asked the question. I cannot see your name. Sorry, sir. I cannot see the name. Can you please, Mr. Sachin? Did I answer your question? Hello? Hello?
Sachin,
Okay.
you can unmute yourself.
Okay, I think what I can do is I can share the screen and this will stop other share screen. Do you want to continue? Should I do it, Rajesh? Okay, let me do one thing. Rajesh, I think let me complete the presentation. Then I can go back to the questions.
Q&A. Yeah, exactly, doctor.
Okay, because then I can show them the videos and images which will help them to clarify better rather than just speaking.
Sure, sure.
So please keep asking the questions. We'll come back to it. Okay, next slide, please. Okay, what is the treatment? Seizures can be treated. That is the most important thing. So in general rule of thumb means if you take in each child, the seizure diagnosis and the treatment varies and the outcome also varies. So what happens in the long term? That can vary based on the age, the cause, and when the treatment was started. Okay, so as a general rule, when we see 100 children, 50% seizure is controlled with one medicine. Another 20% with the second anti-epileptic drug. Another 5% with third or the fourth drug. So almost 75% of the children become seizure-free with medicines. Then you have another 25% of children who do not respond to standard line of medication. In such cases, we have to think of alternative treatment strategies. So what are these treatment strategies? Ketogenic diet, vagal nerve stimulation, and also epilepsy surgery. So general rule of thumb is 75% of them can be treated with medication. So अगर 100 लोगों में लिया तो अब 75 patients में दवा देने से seizure stop होता है. कुछ लोगों को सिर्फ एक ही दवा चाहिए, कुछ लोगों को दो चाहिए, कुछ लोगों को 3 या 5 चाहिए. लेकिन हमें पता है 3 या 4 दवा होने के बाद अगर फिट्स कंट्रोल नहीं हुआ, हम उसको बोलते हैं ड्रग रेजिस्टेंट एपिलेप्सी. उन लोगों में हमें दूसरी तरह का रास्ता ढूंढना पड़ता है कैसा ट्रीट करना है. एक रास्ता है कीटोजेनिक डाइट, दूसरा है वेगल नर्व स्टिमुलेशन और तीसरा है एपिलेप्सी सर्जरी. ये ऐसा ट्रीटमेंट नहीं है कि कोई भी जा सकता है और वो पूछ सकता है मुझे कीटोजेनिक डाइट दे दो या मुझे वेगल नर्व स्टिमुलेशन का सर्जरी कर दो. ऐसा नहीं है. सो एक पेशेंट को क्या डाइट, क्या ट्रीटमेंट, अल्टरनेटिव ट्रीटमेंट होना है, इंडिविजुअलाइज्ड प्लान है. लेकिन आपको सबको समझना बहुत इंपॉर्टेंट है कि ट्रीटमेंट देने के टाइम में डायग्नोसिस बहुत इंपॉर्टेंट है. दूसरी मेडिसिन जो चूज करते हैं वो इंपॉर्टेंट है. और डोसेज, स्पेशली बच्चों में डोसेज देते हैं वेट के अनुसार. अगर कम डोज दिया तो जरूर सीजर कंट्रोल नहीं होगा. हम ये नहीं बता सकते कि देखो मेडिसिन दे दिया कंट्रोल नहीं हुआ अगर हमारा दवा का डोज ठीक नहीं है. सो ये बहुत जरूरी है कि हम सही दवा सही डोज देना पड़ेगा. Okay, so you have to give the right dose, right medicine, provided this can happen only provided we have the right diagnosis. So once you do this and you see that the child is not responding to a standard line of medication, then only you will label it as drug-resistant epilepsy, and then you opt for alternative therapies. And not all therapies can be suitable for everyone. You have to think Even these alternative therapies are like a medicine, and you have to pick and choose according to the patient's diagnosis. Okay, Rajesh, next one. Okay, these are some of the commonly asked questions from parents, FAQs or frequently asked question. Seizure versus epilepsy. So what is seizure? What is epilepsy? So as a rule, seizure is one episode or the single episode where the person has a seizure. उसको हिंदी में झटका भी बोलते हैं. एक एपिसोड हुआ तो उसको हम बोलते हैं seizure. What is epilepsy? Epilepsy is a person is having seizure again and again without a reason or with a reason. So unexplained, unprovoked. So पहली हुआ तो बोलते हैं seizure, first episode. दूसरी बार हुआ तो 2 episodes और उसको बोलते हैं epilepsy. So that is the main difference, but both mean the same, means that episode, whatever happens in that particular child, but epilepsy means unprovoked, बिना वजह हो सकता है, or more than 2 or more. Will seizure cause brain damage? This is a very common question from every parent, or I'm sure adult patient में भी ये सवाल हो सकता है कि brain damage होगा या नहीं होगा. Majority of the seizures, almost 95% of the seizures last less than 5 minutes. So you will not have any brain damage from that. Very rare, maybe 1 or 2 in 100 will have seizures which go on for hours and hours. Sometimes it goes on for several days. These are the types of seizures which can cause brain damage. And secondly, the cause. Sometimes you have infection of the brain itself, and that causes seizure. So in such cases, there is a higher risk of brain damage because the infection has entered into the brain cells. So we always need to understand the context. Will seizure cause brain damage? As a general rule, no, it doesn't, because most of them are short-lasting and brief. Exceptionally, seizures are prolonged. In such cases, brain damage may happen. Very common सवाल है, ये seizure है या epilepsy? अगर एक बार हुआ तो हम उसे बोलते हैं seizure. दूसरी बार हुआ तो हम बोलते हैं epilepsy, और more than 2 या ज्यादा बार seizure हुआ तो उसको हम बोलते हैं epilepsy. Seizure से brain damage होता है नहीं होता है? ये सवाल के लिए जवाब क्यों हुआ वो बहुत important है. लेकिन 100 में 95% के टाइम सीजर्स 5 मिनट में बंद हो जाता है, खुद बंद हो जाता है, उससे कोई प्रॉब्लम नहीं होता. लेकिन कभी कभी क्या होता है, ब्रेन में सीधा इन्फेक्शन घुस चुका है, इसके वजह से ब्रेन का डैमेज भी हो सकता है. दूसरे इस इन्फेक्शन से वजह से सीजर बहुत लॉन्ग हो सकता है, क्या कभी कभी 1 घंटा 2 घंटा 2 दिन 3 दिन भी हो सकता है. इस समय में ब्रेन का डैमेज होने का चांसेस है. Next question is, do I need to take medicine lifelong? This is a very common question. Generally, as a rule, medicine is for 2 years of seizure freedom. अगर 2 साल seizure नहीं हुआ तो medicine का बंद करने का बात कर सकते हैं. लेकिन और एक बार मुझे ध्यान देना है कि क्यों हुआ. पहली सवाल है, fits क्यों हुआ? What was the reason for seizure or epilepsy? Those things matter. What was the EEG finding? What is the MRI finding? How is the child's development? What is the risk? All these things matter before we consider stopping medicine. As a general rule, you can say 2 years of seizure freedom means you can consider weaning or stopping medication. Very important, when I say weaning or stopping medicine, this medical terminology, weaning means gradually कम करना पड़ेगा, sudden से बंद नहीं करना है. Sometimes what happens is when we tell parents after 2 years we'll stop it, just 2 years they suddenly stop. Okay, 2 साल हो गया, कल सुबह से दवा नहीं, वो गलत है. स्टॉक में आपको याद रखना है, अगर दवा बंद करना है, धीरे से स्लो करते धीरे से कम करके बंद करना है. ऐसा नहीं कल सुबह बंद कर लो, ऐसा नहीं. So if you take medicines for a long term, when you decide to stop it or when the doctor advises to stop it, please make sure it is under medical supervision and it has to be done in a slow manner. You should not abruptly stop the medicine. Okay, next question is side effects of medicine. Is there a side effect? Every medicine, forget about medicine, even the food we eat will have side effects if it is taken beyond a certain point. So how do I say? Even if you eat too much food, that can cause problems. Too much sweets, it can cause problem. Similarly, medicine, especially those medicines which you take long term, can have side effects, but luckily it does not happen in each and every individual. So it is important to remember it is side effect and effect. Effect yani positive. So we take the anti-epileptic medication so that the person does not have seizure. That is a positive effect. Side effect is something you don't want. So there are two sides of a coin. तो ऐसा नहीं हो सकता कि मेडिसिन लो लेकिन साइड इफेक्ट नहीं चाहिए. It doesn't work that way. You take the medicine, there is a risk of side effect, but it does not happen in all of them. Will there be any harm with the tests or investigation? जो भी टेस्ट मैंने बताया था EEG, MRI, वो उससे कोई harm नहीं होता. Common investigations like EEG, MRI does not have any radiation, does not cause any pain, and does not cause any damage to the brain even if you do it multiple times. So this is a common question. People think because you're doing the scan of the brain, it may affect the brain. It doesn't. EEG and MRI are safe investigations. Should I get a CT scan or an MRI scan? So this is very important question. A बहुत important सवाल है. कौन सा scan करना है? CT scan या MRI scan? I had already spoken to you about this. CT में radiation होता है. Radiation brain का नुकसान कर सकता है. Immediately नहीं, बहुत सालों के बाद. Radiation can cause long-term problems. So it is very important you please do an MRI scan. Sometimes a doctor may advise CT scan in an emergency. Say somebody goes to an emergency department, he's having seizure, then we may have to get a CT scan. The reason for doing in such cases is CT is very easy to do, very quick, and it takes very short time. And it does not take much effort. Whereas MRI, the person has to stay absolutely still. It can take minimum 20 to 30 minutes. So sometimes the child may not cooperate, but if the seizures are happening and if the doctor is worried about something in the brain, he has to urgently get a CT scan. So there are some times a doctor may advise you. So please keep this in mind. So सवाल था CT scan करना है या MRI scan करना है. अगर emergency हुआ, कभी कभी डॉक्टर ये बोलते हैं CT स्कैन करना पड़ेगा क्योंकि CT स्कैन करना बहुत जल्दी है और आसान है, लेकिन उसमें रेडिएशन होता है. जब नहीं चाहिए नहीं करना है. लेकिन MRI स्कैन में कोई रेडिएशन नहीं होता, बहुत मेहनत करना पड़ता है और टाइम ज्यादा लगता है. नेक्स्ट क्वेश्चन इज विल रिपीटेड EEG कॉज एनी हार्म? अगर आप EEG बार बार करते रहे तो कोई नुकसान हो सकता है? नहीं, ऐसा नहीं है. EEG करने से कोई नुकसान नहीं होता. वो सिर्फ आपका वक्त, बच्चे का कोऑपरेशन चाहिए, टाइम चाहिए, लेकिन कोई हार्म नहीं होता. कोई इलेक्ट्रिसिटी नहीं अंदर नहीं जा रहा है. EEG does not carry any electricity or into the brain or cause any pain. It is just recording the electrical activity from the surface of the brain. Okay, next slide please. So क्या प्रॉब्लम है एपिलेप्सी में? एपिलेप्सी का बहुत बड़ा प्रॉब्लम है स्टिग्मा. स्टिग्मा यानी अगर एपिलेप्सी हो गया तो सबको ये लगता है कि ऐसा डिजीज आ गया जिनका पास ट्रीटमेंट नहीं है या सोसाइटी में इंसल्ट होता है. किसी को बताने में भी शर्माते हैं लोग. Agreed, the stigma is much more painful and much more difficult to treat in epilepsy than anything else. Rajesh, I don't know if you know what is the Hindi word of stigma. Somebody can help me. What is the word for stigma in Hindi?
Even I am not aware about it.
Okay. कलंक है ना, लोगों को एक कलंक जैसा लगता है. क्यों ऐसा होता है उसके बारे में बात करते हैं. नेक्स्ट स्लाइड राजेश. So a stigma, why is epilepsy stigmatized? See, epilepsy, let's look at the incidence. How many people have epilepsy in the world? This is the world, I'm talking about the world numbers here. 50 million. 50 million यानी 50 करोड़. लेकिन asthma 262 million. Lot of people have asthma. So people get used to seeing somebody in asthmatic. Maybe somebody in your family has asthma, somebody in your neighbor has asthma. So people get used to it. Look at diabetes, 422 million. So it's a huge number. So somebody says, मुझे diabetes आ गया. Nobody's worried. Oh, okay, दवा ले रहे हो, injection ले रहे हो, diet control करो, ठीक है. let's go on, carry on with life. Whereas epilepsy is not very common. So people have a lot of misconception. So people assume. It is very easy to assume what you do not know because nobody goes and looks at facts. Next slide, ma. So because it is very uncommon, and secondly, the commonest seizure which people recognize is the one where there is a shaking of the limb. So people think you're possessed. So some devil or some soul or some life form has entered into you and made you do that. क्योंकि ये कंडीशन बहुत रेयर है, लोगों को उसके बारे में बहुत सारे गलतफहमियां हैं. They don't realize what it is. So लोगों का assumption है ये हो सकता है, ये हो सकता है, क्योंकि कोई ऐसा कोशिश नहीं करता क्यों वो क्यों हो रहा है उसके बारे में जानने की कोशिश कोई नहीं करता. आजकल तो सबके पास व्हाट्सएप है, इंटरनेट है, पढ़ सकते हैं, लेकिन ये सोचो 100 years बैक क्या बोलते हैं, पुराने जमाने में टीवी नहीं था, इंटरनेट तो नहीं था, पढ़ना लिखना नहीं आता, तो लोगों को मन में जो आया वो बता सकते थे. अगर आपके दोस्त में आ गया तो बता सकते हैं देखो ये कुछ हो गया, मदद करेंगे. अगर आपके जो पसंद नहीं है या दुश्मन है उसको बोल देते हैं चलो उसमें कोई आत्मा चल चुका है, वो आज अभी उसको शहर से बाहर डालना पड़ेगा. दिस इज हाउ पीपल विद एपिलेप्सी वर थ्रोन आउट ऑफ विलेजेस और होम्स. Third reason why people are very afraid or fearful of epilepsy, it's unpredictability. आपको ये पता नहीं चलता कि कब होगा. लेकिन अगर आप डायबिटीज के बारे में सोचें तो वो आदमी को पता है, देखो अभी मैं खाना खा रहा हूँ, शुगर टेस्ट करना पड़ेगा, खाना खाने के बाद मुझे दवा या इंजेक्शन लेना पड़ेगा. लेकिन एपिलेप्सी में ऐसा नहीं है, सो आपको पता नहीं चलता कब होगा. सो दिस अनप्रेडिक्टेबिलिटी गिव्स राइज टू लॉट ऑफ कंफ्यूजन, फियर. क्योंकि एवरी पेरेंट क्योंकि मैं पीडियाट्रिक न्यूरोलॉजिस्ट हूँ, जो बच्चों को माँ बाप लेके आते हैं उनका बड़ा डर है कब होगा. अगर मैं काम कर रहा हूँ, मैं ऑफिस में गया तो हो गया तो क्या करूँ. This fear is there because of unpredictability. और लोगों को ये लगता है हम कुछ नहीं कर सकते, क्योंकि स्टॉप करने के लिए दवा तो ले सकते हैं लेकिन we cannot stop it. So this unpredictability gives rise to a lot of fear and helplessness that leads to a lot of stigma. Okay, next slide, Rajesh. So how to overcome? So it is very easy for us to say, okay, बहुत सारे गलतफहमियां हैं, ये है, वो है, लेकिन उसको बदलना हमारा हाथ में है. हम कोई डॉक्टर या गवर्नमेंट का वेट नहीं कर सकते. सो इट इज वेरी इंपॉर्टेंट पेरेंट्स जॉइन हैंड, फॉर्म सपोर्ट ग्रुप्स, एजुकेट द पब्लिक and also make changes with the government or the lawmakers. I'll tell you why. It is the only way forward is to joining hands and influence the lawmakers. For example, driving license. Do you know in India, if you have epilepsy, you are not supposed to drive. But generally, people don't disclose. People go on and take random chance. It is risky for their life and also the lives of other people who are driving on the road. Whereas in the Western world, if somebody is seizure free for 6 months or 1 year, they have allowed the person to drive under supervision, under medication, under regular medical follow-up, because we know the chances of seizure recurrence is very low. So people are allowed, so they can legally drive. So this has been brought about because of the demands of the public, because you cannot make a law and sit on it without reviewing it. So this kind of changes has to be brought at a government level by the active participation of the public, whether it is a patient or a parent. Otherwise, it will not happen, because the government makes probably hundreds of laws every year, and they would not know what is a shortcoming unless the public give a feedback. So it is very important people come together. अगर कुछ कानून बदलना है, हम कानून का साथ देना पड़ता है. हम ये नहीं बता सकते चलो वो मोदी नहीं किया, वो नहीं किया, वो नहीं हो, वो ऐसा होना था. ऐसे बात करने से कुछ नहीं होता. हम सब साथ मिलना है और गवर्नमेंट को फीडबैक देना है. अगर कोई कानून ठीक नहीं है, अप टू डेट नहीं है, वो चेंज करना पड़ेगा. So another example, advocacy or where the patient support groups. Up to 1970, 1980, if somebody had a seizure, you could have just divorced or closed the marriage. It is called annulment, means शादी का डाइवर्स कर सकते हैं अगर सीजर हो गया. So it was a law. So it is now we know it is very silly. Now the government has changed only after a lot of pressure from social groups. So because government, when it makes a rule, it takes the advice of few people and makes a law. So you cannot say, okay, the whatever law is made, that is fine. Everything has to change with time. 50 years ago, maybe we did not have enough medicine, but now we have better medicine, better diagnostics. We can give a better results. So somebody getting divorced only because they have epilepsy is silly or foolish in these days. So it is very important people join hands and give feedback and bring about change in the society, what they want to see. Okay, next one, please. Next slide. So I think with this, I will end my talk. I'll start answering the questions, what is there in the chat box first, and then I will start asking you people to ask the questions directly. Is it okay? First and foremost, what I will do is, before people drop off or disconnect, I'll share my social media links on the chat box. So whoever is so active on social media can connect with that. जो भी वो फेसबुक में है या इंस्टाग्राम, लिंक्डइन, उसका मैंने लिंक शेयर किया है, वो आप देख सकते हैं. अभी मैं मेरा स्क्रीन शेयर कर सकता हूँ और एक के बाद एक सवाल आंसर करता हूँ जो चैट बॉक्स में है. Okay, first foremost question is MTS and FCD. I think this was Mr. Sachin. Can I share the screen, Mr. Rajesh?
Yeah, sure.
Okay, can you see the screen?
Yes, sir.
So somebody asked me what is mesial temporal sclerosis. Okay, so this is the brain MRI. If you look at the temporal lobe, can you see it? Hello?
Yes, doctor. Yes, doctor.
Yes,
Okay.
yes, doctor.
This is called the medial temporal lobe, and if you want to see how it should be, it is normal, well circumscribed here, whereas this side it is very shrunken. This is called mesial temporal lobe sclerosis. So when this happens, it can give rise to more seizure. So another image, probably this is brighter here. You can see this is well formed here. यहाँ ठीक से हुआ है, लेकिन यहाँ कुछ स्कार हुआ है. उसको बोलते हैं mesial temporal lobe sclerosis. Okay, so that answers your question, Mr. Sachin. Hello. Let me see chat box. Where is the chat? Stop sharing. Okay. Next question was whether epilepsy affects normal intelligence of kids. See, as I mentioned earlier, the chances of epilepsy affecting the intelligence is very low. Whereas if the seizures are not well controlled, then it can affect the intelligence. It can affect the learning process. सवाल था क्या epilepsy बुद्धि इंटेलिजेंस को क्या बोलते हैं हिंदी में? कोई हेल्प कर सकता है? अकल नहीं.
सर जैसे बच्चे का IQ वगैरह इसके ऊपर.
IQ, correct. Thank you. So will epilepsy affect the IQ of the person, intelligence? Generally, no. Not every person will. As I said in the beginning, most of the seizures are brief and self-resolving. They will not will not impair the intelligence. लेकिन कुछ epilepsy ऐसा होता है कि बार-बार होता रहता है और कभी-कभी आंखों में नहीं दिखाई नहीं देता, लेकिन ब्रेन में abnormal होता है. वो इंटेलिजेंस को अफेक्ट कर सकता है. इस सवाल का जवाब है स्ट्रेट फॉरवर्ड आंसर नहीं है, लेकिन बहुत सारे मेजॉरिटी बच्चों में उसका इंटेलिजेंस अफेक्ट नहीं होता.
तो मेरा एक और क्वेश्चन है कि
एक मिनट कौन बात कर रहा है? एक मिनट.
तो सानवी कपूर.
ओके, एक मिनट, इफ यू डोंट माइंड. और सानवी कपूर, और आपने पूछा था, पूछिए प्लीज.
यस सर. तो एक ये चीज है कि जैसे हम इसमें देते हैं वैक्सीनेशन आती है DPT, इसमें हम एपिलेप्सी पेशेंट में एसेलुलर परटूसिस देते हैं.
या ओके.
तो सर अगर सीजर बच्चे का खत्म हो गया है, उसके बाद अगर हमने वैक्सीनेशन देनी है तो फिर हमने उसे डीपीटी देनी है या कि सिर्फ एसेलुलर परटूसिस वाली वैक्सीन देनी है?
ओके, दोनों भी ठीक है, सीजर खत्म होने के बाद भी दे सकते हैं, लेकिन आप अगर वैक्सीन धीरे कर रहे हो वो सही नहीं है। आप बोल रहे हैं उसका सीजर खत्म होना तो कम से कम 2 साल का दवा देना है। डीपीटी तो फर्स्ट
सीजर खत्म हो चुके हैं बच्चे को, बच्चा अभी 10 इयर्स का है, तो 10 इयर्स में देनी है नहीं हमने जैसे डीपीटी?
दे सकते हैं, दोनों भी काफी है, दोनों भी सेफ है। ये सेलुलर हो सके तो वही दे दीजिए।
ओके सर। फिर एक और मेरा क्वेश्चन है कि अगर बच्चे को स्कूल में आ जाए कुछ ऐसे सीजर वगैरह, क्योंकि अब छोटे बच्चे हैं जैसे 5-6 इयर्स के हैं, उनको स्कूल में क्या मैनेजमेंट?
सीजर मैनेजमेंट कैसा? ओके, मैं वो बता सकता हूँ। उसके लिए शायद मैं एक वीडियो दिखाना पड़ेगा। मैंने एक वीडियो बनाया है कैसे वो सीजर को मैनेज करना है। 1 मिनट। वो लिंक आपको शेयर करता हूँ, शायद मैं अस्पताल में हूँ, वो शायद YouTube परमिट नहीं होता।
तो मेरा एक और क्वेश्चन है।
बोलिए सर।
सर मेरे बच्चे को सीजर हुए थे 6 मंथ्स की एज में।
Okay.
उसके बाद उससे दवाई चली, दवाई के बाद जैसे पीजीआई वालों ने बोला कि टैपर कर दो, उनके अकॉर्डिंग हमने टैपर की। सर उस टाइम वो लिवर्सिटैम ड्रग पे थी, लिवर्सिटैम, और उसके ऊपर ये था गार्डिनाल पे, गार्डिनाल खत्म कर चुके थे वो, लिवर्सिटैम चल रहा था सर। सर लिवर्सिटैम टैपर करने के बाद उसे जैसे ही टैपर हुआ, जिस दिन खत्म हुआ टैपरिंग पे, तब दोबारा से सीजर शुरू हो गए। सर अब उसे 6-7 इयर्स हो गए हैं दवाई खाते हुए।
ओके, एक प्रॉब्लम है मैडम, बिना मुझे तो पूरा इंफॉर्मेशन चाहिए।
यस सर।
वो ईजी क्या था, एमआरआई क्या था, एग्जामिनेशन, एक मिनट, वो सब बिना देखे मैं आपको ट्रीटमेंट सही है नहीं सही है वो मैं बताना बहुत मुश्किल है। अभी तो इंडिविजुअल ट्रीटमेंट के बारे में बात करना थोड़ा मुश्किल है मैम। प्लीज डोंट माइंड, बिकॉज अगर आप पीजीआई में गए, एम्स में गए, तो बहुत सारे अच्छे न्यूरोलॉजिस्ट है, वो शायद वहाँ ठीक से इन्वेस्टिगेशन किया है और ट्रीटमेंट का डिसीजन भी ऐसा हुआ है। तो मैं फोन में बिना बच्चे को एग्जामिन करके नहीं बता सकता। ठीक है। So next question was Balaji Nagarajan. I am a student studying BSc Neuroelectrophysiology. Which is most advised given to me to do the patient and also for my studies? Sorry, I did not understand this question at all. कोई बता सकता है क्या? Balaji Nagarajan, are you there? Hello? Okay, I'll go for the next one because I'm sorry I cannot understand this question. Geeta Pawar, if father is having epilepsy problem, what is the chance of child may get the same problem in the future? So once again, this is a question for which there is no answer, clear-cut answer. We need to understand what is the reason for the seizure in the father. As a general rule, if you remember, I mentioned about the slide where it said 50% of the cases there is no cause known. So we may not be able to identify the type of seizure. In such cases, the chances of the child having is very low. But we need to once again look at what is the child's father's reason for epilepsy, what is the underlying cause, and then we may be able to help you out. So सवाल था, अगर बाप को एपिलेप्सी हो रहा है तो बच्चे में एपिलेप्सी हो सकता है, तो उसका स्ट्रेट फॉरवर्ड आंसर नहीं है, क्योंकि हमें पहला पता चलाना है कि फादर में या बाप में क्यों हो रहा है, उसके बाद ही बता सकता है कि सीजर बच्चे में होता है नहीं होता है। ओके, गुड इवनिंग सर, इज देयर अ रिलेशनशिप बिटवीन स्लीप एंड एपिलेप्सी? एक बहुत अच्छा सवाल है सोनाल शर्मा से। गुड इवनिंग सर, इज देयर अ रिलेशनशिप बिटवीन स्लीप एंड एपिलेप्सी? ये सवाल था अगर एपिलेप्सी और नींद में लिंक है। स्लीप डिप्रिवेशन इज द कॉमनेस्ट रीजन फॉर एपिलेप्सी और एपिलेप्सी ट्रिगर्स। अगर किसी को एपिलेप्सी या सीजर आने का रिस्क है, अगर नींद ठीक से नहीं किया तो सीजर होता है। ठीक है। So good sleep is very important for healthy brain and for the brain to function normally. Many times we also ask for something called sleep deprived EEG. ईजी करने से टाइम में हमें ईजी का गेन ज्यादा करने के लिए हमें क्या करता है, स्लीप, नींद कम करके आने को बोलते हैं, ताकि वो ईजी का फाइंडिंग्स जो है वो बेटर हो सकता है. How can we predict seizure or epilepsy before the occurrence? So this is a question from Mr. Amit Joshi. सवाल था, सीजर या एपिलेप्सी होने से पहले पता चल सकता है क्या, कैसा पता चला सकता है? It is very difficult to identify seizure or epilepsy before it happens. In some cases, adults can identify some features. It is called aura. कुछ लोगों को पता चलता है, ओ अभी सीजर होगा. Rajesh, I think you may have to mute people now.
Done, sir.
Okay, thank you. So sometimes people can recognize some features which tells you, okay, the seizure is going to come. This even some children recognize. They recognize something is happening, and because it happens again and again, they know this is not correct, and they rush to the parents and hold them. So this is something you can tell you the seizure is going to happen now, but it is not practically possible to predict. Okay, 3 o'clock usko seizure hoga, 4 o'clock usko seizure hoga, nahi pata chala sakta. Can I discuss about my mom who had head injury? One second, ma. One second. Can I discuss about my mom who had head injury and undergone surgery? Now she gets seizures. I think this is a question from Merab. Are you there? I think Merab, you can unmute yourself and ask the question, please.
Good evening, sir.
Good evening, ma'am. Where are you calling from?
Chennai, sir. Chennai.
Okay, please tell me. Please tell me.
She underwent cranioplasty surgery, sir, after her head injury.
How did the head injury happen?
Drink and drive. Somebody pushed her from the bike.
Okay. Was she walking or was she riding?
She was riding with my father.
Okay. Was she wearing a helmet?
No, sir. No, sir.
Okay. So as I mentioned earlier, very important message for all of us to make sure that we wear helmet if we're riding right way. Please go on, ma'am. Please ask me the question. I'm sorry to hear. Please tell me.
It's okay, sir. Past 11 years, she's under treatment, sir, and she was paralyzed right side fully, because left side they have replaced the flap once again, and the the flap started shrinking, the skull bone which they replaced. And the seizures occurred early once or twice, but now she's getting it recurrently, sir. Even per day 3 or 4 times. And when we just went on to a neurologist, he suggested to continue with Encorate medicine. But she was very active before the seizures. Now, after taking that medicine, she's fully drowsy and she's not able to walk. She's right now 74. The surgery, when she underwent surgery at the age of 62. So that's my question, sir. I know there's a side effect in taking the medicine for all these years, but suddenly doctor asked to stop that medicine, and now because of this recurrent seizures, she's been diagnosed with it. Is there any other way that we can give some other medicines, sir?
Okay, Meera, I also sent you a message on your chat box because some of the questions I cannot ask you openly.
Okay.
Is your mother being seen by a neurologist or a neurosurgeon?
Sir, neurosurgeon, sir.
Have you met a neurologist?
Yes, sir.
Okay. So I'm surprised because your mother still has multiple seizures and she's only on one medicine. So it may be important. It may be important for you to once again speak to the neurologist and see if any other medicine can be added.
Yes, sir. Actually, we had reduced before we could go and meet. Only just last week, we just went for an appointment with the neurologist. Before we could go, we started the medicine with very less mg, 200 mg. She was fine. And when we met and we had to go for CT scan and EEG, and they suggested it's truly a miracle that she's alive till now with all these complications. Because one way it is God's grace and another way you have taken care. but she has to be on medication continuously. They said she need not come for a review. You just carry out with whatever you're doing so far. And but now she's not taking her food, or she's not that active. She was able to walk all alone. Only her right hand was paralyzed, and she was able to walk. But now she's like bedridden. And fortunately, I just came across this Zoom meeting, sir. That's why I thought I would just ask.
Fine, no problem. Madam, what I can do is, it may be a very complex case. I've sent you my WhatsApp number on your chat box. You can send me that report. We can catch up later.
Yeah, thank you.
Thank you very much for coming.
Thank you, sir. Thank you.
Thank you. Next question is from Bhanupriya. The question is, cerebral atrophy in children means what, sir? Do they require prophylactic seizure management? Okay, so first and foremost, cerebral atrophy means the brain, what is there, has to grow to a certain extent. When it doesn't, we call it a cerebral atrophy. So cerebral atrophy does not per se mean there will be seizure. Okay, so you will not need a anti-epileptic medicine. Let me show you what it is. Just normal. Can I share the screen for a second? Okay, can you all see my screen?
Yes, doctor.
I think it's loading up. Okay, if you see this image, on the left-hand side, you see the thick white layer here. This is the skull. Can you all see me? Can you hear me?
Yes,
Rajesh?
sir.
Okay, this is the thick one is a skull, and between the skull and the brain, there is a huge gap, the black area. And this black area in this image is also the CSF. CSF is the cerebrospinal fluid, which we were discussing. It acts as a cushion inside and cushion outside. It also supplies the nutrition and it also cleanses. Whereas look on the right side. On the right side, you see that there is gap between the skull and the brain is very minimum. So this is normally grown brain, whereas here it is shrunken. You can see the gap here. This is called cerebral atrophy. There are many reasons why this can happen. So it depends on individual cases, and there is no general rule to say child with cerebral atrophy will have seizure. So we would not start a prophylactic medicine without knowing the underlying cause. Okay, next question is, okay, Shaheen Abdullah, child having developmental delay diagnosis from infancy, developed epilepsy from 9 years. No reason found. You mentioned was done, except which I have not heard of this. I'm missing something about. Should I ask my doctor to perform this test? Okay, this is a question from Ms. Shaheen Abdullah. Child having developmental delay, epilepsy, all investigations done, including genetic, we have not found a cause. Okay, I mentioned, if you remember in my slide, I mentioned CSF analysis plus or minus. We may have to, but not in all the cases. So once again, this depends upon what is the cause of epilepsy and what is the type of developmental delay in your child. You can always discuss this with your consultant. I don't know where you are from, Shaheen. Can you please tell me where you're from?
Yeah, I'm from the UAE actually.
Oh, okay. UAE, I don't know. UAE, maybe in Saudi Arabia, sorry, Dubai. There are a lot of neurologists. You can discuss with them. It is not required in all the cases. Just to answer that specific question.
Okay.
Thank you very much, ma. Thank you for coming. Okay, next one is Geeta Power. If seizure replace after a few years, then we have to change medicine or not? Oh, you basically mean if seizure recurs. I hope I have understood your question. Not necessarily. If seizure comes back after 2 years, we have to once again ask the question why. Why did the seizure come back? Do we need to increase the dose of medicine? Do we need to change the medicine? It depends upon why it happened. So there is no straightforward answer, not required. I need to push the timing of medication 2 hours earlier with the start of school. How can I do this safely? As I was told, it's important to maintain the time to prevent a seizure. Okay, once again, it's Shaheen. It's very important to give the medicines on time so that the drug levels are well maintained. When you say time, there is always a window. For example, what I would advise a parent in my consultation room is, let's say if the patient is given medicine at 8 o'clock and 8 o'clock, 8 o'clock morning, 8 o'clock in the night, 12 hours gap. So I would say between 7:30 to 8:30 in the morning, 7:30 to 8:30 in the night. So half an hour before or half an hour later of that time has to be fixed. But you cannot give one day 7:30, the other day is 8:30, next day is 9:30. It doesn't go like that. So time is fixed 8 and 8, half an hour before or half an hour later. The other issue is regarding the school or medication. If the child is old enough to swallow a tablet, it is better to go for a tablet, because sometimes what happens, you give the syrup and the child goes and sleeps in the class. So this is important to remember. Okay, I hope I have answered your question, Shaheen. I'll go to.
So you're telling me that I have to like push it half an hour earlier?
Okay. If you want to move shift 2 hours, first day I will shift by half an hour. Then the next day again half an hour. Gradually shift it to 2 hours.
Okay, so this can be done like every day, half an
Yes.
hour one day, second day another half an hour earlier.
Yeah, let's say today you're giving at 10 o'clock. Tomorrow give it at 9:30, 9:30, and the next day give it 9 and 9, 8:30, 8:30, and gradually bring it to 8 and 8. What you would want.
Okay, so both day and night I have to shift it.
We have to ideally give 12 hours gap. Most of the medicines have that life, 12 hours life.
Okay. Okay.
Next question is, thank you, ma'am. Thank you. Next question is from Saraj Pandit. I'm on medication for 20+ years. Whenever doctor advises me to decrease the medication, seizures happen again. So once again, sir, this depends upon case-by-case basis. As a general rule of thumb, after 2 years of seizure freedom, we would consider stopping medication. But if there is an underlying cause, it may be possible that medicines may have to be taken lifelong. Okay, Mr. Balaji Nagarajan has said, can you please tell me about stigma? I think stigma we discussed in later. And Sanvi Kapoor, thank you for suggesting curse. Okay, what is the management procedure at home or school? I just shared a video which tells you what you have to do when the seizures happen at home or at schools. General precautions. In addition, there is a medicine called midazolam, which you can use it as a spray. There are many companies like this which make the spray. So this is one company. It's not that I'm recommending it. It is one of the commonly available ones from Cipla. There are 3 other companies which make this medicine. You have to give the medicine through the nose. So I've made a video which I've shared it with you on the group. Okay, I think it's in the chat box. Please have a look. Chat box. Yeah, I'll share this again, seizure management video. I'll share it again with all of you. Please make note of it. It's in Kannada and English. Oh, sorry. Okay, once again, give me a second, sir. I'll send you share the video with you guys. Okay, just share the video link again. Can you hear me?
Yes, doctor.
Okay. Okay, now I'll come back to the question, seizure management. What English? My daughter is, this is a question from Debrani Chandrani. My daughter is taking levetiracetam from 2 years, sir. What I notice her skin has become dull. Please suggest me what to do. Generally, levetiracetam does not cause any skin changes, but if you have noticed something, please speak to your doctor. So it is very difficult to comment without seeing what it is. Next question is from Shilpa Rani. What is the purpose of doing whole exome sequencing for epilepsy? Last time this has done for my child. Okay, if you remember in the list of causes for epilepsy, genetic causes are one of the commonest things. So when you've done an EEG, MRI, clinical examination, history, there may be a reason why your doctor has suspected a genetic cause of epilepsy. And for that reason, they have explained or they've asked you to get a whole exome sequencing. If we identify the gene, it will help us to tailor make the medicine. There may be certain genetic conditions where the medicine works, a particular medicine works better than the other. So it is important, and I hope you've done it. Okay, next question is from Momita Ghosh. Can hormonal disturbance cause seizure? Yes, it can. There are certain conditions, certain situations where seizures are more likely to happen just before the onset of periods in a female. Teenage years are very common. So yes, hormonal disturbances can cause a seizure. I hope I've answered your question there. Next question is from Siraj Pandit once again. I've gone through all the stages of diagnosis like EG, MRI, etc. But every result was normal. Still, I got various episodes of epilepsy. Can I go for COVID vaccine jab? I'm sorry to hear that, Siraj. Yes, you can go ahead with vaccine. I hope you've done the right investigation and hope your seizure is well controlled. Yes, it's very unfortunate. Many times we cannot find an answer. Next question is from Banumati. Sir, can juvenile absence seizure be cured? So most of the times juvenile absence epilepsy starts in teenage years and medicines may have to be given long term. And then some cases it may be even lifelong. So once again, it depends upon our individual case. We need to look at the child, look at the investigation, and then advise whether medicine has to be, whether the juvenile myoclonic epilepsy can be cured. Next question is from Mr. Shashikant Bole. My son, now 28 years old, had epilepsy at the time of his birth in February 1992. He was admitted to the hospital, done some tests like MRI, was given various drugs including Gardinal, continued for 2 to 3 years. He seemed a little lazy, probably because of Gardinal side effect. Agree. Another doctor opinion, we stopped Gardinal, but we were in a big mess. We did not have any problems after that. Please explain what you think. So, Mr. Shashikant, I think you're there. You can unmute yourself, yes. And if you want to add anything.
Yes, sir.
Please tell me, sir.
Yes, sir. Yeah, sir, my son is now 28 years old, but at the time of his birth, he got epilepsy and he was in hospital for around a week or I think 10 days. Mm-hmm. He was undergone the test like MRI, etc. Okay. And he was given the tablet that time Gardinal.
Yeah.
But the doctor said, yeah. But I took another doctor's opinion when he asked to stop because his activities was slow. So he said that it is due to the side effect of Gardinal. So we stopped the Gardinal.
How long did you give Gardinal for?
For the epilepsy.
How long? How long?
I think it may be around 2 years, 2 to 3 years.
Okay, that itself should not cause, what do you say, dullness or lazy. There may be some other reason. What I can only say is you have done the right decision. If you have not had any seizure, Gardinal is not required. Unfortunately, if you look at 28 years ago, it was one of the commonly available medicine. In fact, only medicine available in a government setting. I don't know where you're calling from, Mr. Shashikant.
Yeah, I'm calling from Nagpur, sir. Nagpur.
So unfortunately, we were not able to get any other medicines in a government setup in those times.
But we are afraid that if suppose same thing happens, that epilepsy after 28 years. So what to do or how to check whether he is already freed from that problem?
Okay. So what does he do now? He's 28 years old. What does he do for a living?
No, he's doing management in IIM.
Management in Indian Institute of Management?
Yeah, MBA. Yeah, MBA, IIM Visakhapatnam.
And why are you worried about it now? You must be a very bright guy to get into IIM.
Yeah. But I pray that whether I did a mistake by stopping the Gardinal or not, or that's why I'm under tension.
No, why? This was, okay, you started the medicine of Gardinal when he was born, correct?
Yeah.
You gave it for 2 to 3 years and you stopped it.
Yeah.
So he's been 25 years without medicine.
Yeah.
So why are you worried about seizure now?
No, I thought because I stopped the Gardinal by taking the second opinion of another doctor.
Mm-hmm.
So that's I wanted to clear that whether there is any test that to find whether he is free from that all the epilepsy that he had at the time of birth.
Okay, sir, what do you do for a living?
Yeah, I'm retired professor.
Okay, sir. I think you're rightly, as a father, you're thinking in the right way, but you have to trust yourself. For 25 years, he's been well, he will be fine.
Yeah.
You don't need any test.
Yes, sir.
Correct?
Okay.
So be happy, be grateful, and don't worry.
Yes, sir.
There are certain times where investigation or treatment cannot solve the problem. Simple example, Corona. It's a good opportunity for all of us to learn the lessons. Medicine, investigations, tests cannot solve all the problems. Money cannot buy health. I hope this is an important message from COVID. Okay, sir. All the best. I hope your son will do well. Thank you. Next question is from Siraj Pandit. Can I go for COVID vaccine? Yes, you can go out for COVID vaccine. Next question is from Mansi Mukul. Sir, can direct light or sudden light exposure act as a stimuli for seizure? Yes. If you have ever undergone an EEG, we do something called photic stimulation, where the light keeps blinking at different frequencies. That is to see if a person is photosensitive. Photosensitive means the light coming at a certain frequency can trigger off the seizure. Yes, it can happen. Next question is from Ramesh Lambate. Occipital lobe epilepsy. My child, 7 years, 4 to 5 episodes it takes. Please explain. So once again, Mr. Ramesh, it is very difficult to answer this question. What I can say is occipital lobe epilepsy. One of the commonest reason for occipital lobe epilepsy is hypoglycemic episode. I don't know if your son had any hypoglycemic episode. Hypoglycemia means low blood sugar. That will cause occipital lobe scarring, and that can cause seizures, which are very difficult to treat. So if that is the case, it is a different issue. Are you still there, Mr. Ramesh?
Yes, sir.
So it is. Did he have hypoglycemic episode?
Sorry, sir.
Hypoglycemia, low blood sugar when he was born.
Sorry, sir. Hindi, sir, please.
Okay. जब बच्चा पैदा हुआ, शुगर कम हुआ था?
नहीं, sir.
कब हुआ था सीजर?
देखिए सर, जब वो 9 months का था, तब उसे क्या बोलते हैं उसे, वो सीजर्स आना शुरू हुआ था उस वक्त 9 months में.
ओके.
तो क्या उसे टेम्परेचर में सीजर्स आए थे उसे.
ठीक है. शायद हो सकता है कि कोई प्रॉब्लम था, इसके लिए हो सकता है. 1 second.
हेलो सर.
सॉरी, आप अभी हमें ये पता चलना है कि क्यों ऐसा हुआ. व्हाट वाज द रीजन फॉर सीजर? एमआरआई में कोई स्कार है?
नहीं सर, एमआरआई और ईईजी नॉर्मल है.
ओके. Okay, कभी-कभी one more question. MRI, which I should have probably mentioned, MRI sometimes we say it's normal, depends upon the type of MRI. See, MRI कभी-कभी क्या होता है, लोग जब हम बोलते हैं MRI करना है, कहाँ कम है वहाँ करवा लेते हैं, और कहीं शहरों में MRI अच्छी स्कैन नहीं है.
हाँ.
ठीक है. आप कहाँ से फोन कर रहे हो?
अभी सर लातूर महाराष्ट्र से.
Latur, I don't know. I think you may have a good images. I will show you one comparison.
अभी उसका ट्रीटमेंट सर हैदराबाद चल रहा है किम्स में.
Okay. So let me see. So I'll show you why sometimes we insist to patients we need to do at a good scanner. यानी कभी-कभी हम लोगों को बोलते हैं कि इसी जगह में स्कैन कराओ, क्योंकि स्कैनर का मशीन का भी डिफरेंस होता है. सिंपल एग्जांपल देता हूँ कि आप चलो एक सैमसंग फोन लेने गए, वो क्या पूछते हैं आपको, सैमसंग ये 8 चाहिए, 11 चाहिए, 20 चाहिए, 21 चाहिए, 21S चाहिए, क्योंकि एक मॉडल का अलग-अलग वैरायटी होता है. शायद फोन
सर उसका 1.5 टेस्ला का एमआरआई हो चुका है. अभी मैडम ने कहा है कि अगले नेक्स्ट 6 months में हम उसका एक कंट्रोल नहीं हुआ तो 3 टेस्ला एमआरआई करके देखेंगे उसका.
Good. So 3 Tesla is the maximum clarity which we get in MRI today.
Yes,
so
sir.
Internet में I'm trying to search if I can show you a comparison so people understand why we insist on certain sequences. लेकिन कभी-कभी क्या होता है, लोगों को समझते हैं MRI तो सभी एक ही है. नहीं, ऐसा नहीं है. Not every MRI is the same.
Yes sir. ये बात पूछनी थी सर आपसे कि अभी उसका जो है सीजर्स बोले तो उसे जनरलाइज सीजर्स नहीं है सर. सिर्फ उसे जो उसकी राइट आई है, जो आंख है, वो उसमें उसे रेनबो की तरह उसको कलरफुल दिखता है खाली, और 10 to 15 सेकंड्स के लिए उसके बीच में ही दिखता है. बाकी उसको ऐसा स्टेरिंग नहीं रहता है, कुछ नहीं रहता है. वो बस उसे ऑरा, आप जैसे बोलते हैं ना, ऑरा दिखता है उसमें.
Correct.
Yes sir.
So I think you're picked up very well, and also occipital lobe, यानी
First
occipital
time,
lobe
sir.
होता है पीछे होता है और विजन
Yes,
का
sir.
सेंटर है,
Yes, sir.
वहां सीजर हुआ तो शायद एक ऐसा हो सकता है।
फर्स्ट टाइम उसे देखिए रैपिड फ्लटरिंग ऑफ आईज ऐसा हुआ था, जैसे एक ही आंख बार बार फड़फड़ाना हुआ था लास्ट ईयर में, लास्ट मार्च लॉकडाउन था, मार्च 2020 में। तो उस वक्त हमने थोड़ा सा इग्नोर किया कि खेलने से वगैरह हुआ होगा शायद। तो वैसे 15 दिन के बाद 3-4 बार हुआ। तो हमने पीडियाट्रिशियन को दिखाने के बाद उन्होंने कहा कि ये अभी तो नॉर्मल नहीं है, ये अब नॉर्मल है। तो उसका एक वीडियो बनाया चाहता था उन्होंने, तो उसका एक वीडियो हमने पीडियाट्रिशियन को दिखाया, तो उन्होंने न्यूरोलॉजिस्ट को कंसल्ट करने के लिए कहा। सो लास्ट ईयर से अभी उसका मेडिकेशन चालू है सर।
अभी कंट्रोल हुआ?
अभी वो फ्लटरिंग ऑफ आईज जो बात कही थी आपसे मैंने, वो पूरा का पूरा कंट्रोल है सर। बस अभी जो चालू है तो जैसे मैंने आपसे कहा तो उसके राइट आई जो है तो उसमें सिर्फ ऑरा आ रहा है उससे।
ओके, ठीक है। One quickly, I'll share one photo of MRI. See, दोनों MRI है, आप देख सकते हैं अभी?
Yes sir.
लेफ्ट में जैसा है, राइट में अलग है।
Yes sir.
So, see, I'll speak in English so everybody can benefit.
Okay.
See, the MRI is both are MRI images, left and right. But look at the clarity on the right, and look at the clarity on the left. So that is where MRI quality or the sequences vary. So it is very important we do the right images before we say MRI is normal. MRI normal बोलने से पहले हमें पहला सवाल है क्या ठीक से MRI करवाया, वो उसका जवाब देना पड़ता है। EG नॉर्मल है, क्या ठीक से EG करवाया, वो भी आंसर करना है। सो बहुत सारे प्रोबेबिलिटीज है। सो इसके लिए ठीक से इन्वेस्टिगेशन करना, ठीक सवाल का जवाब मिलना है तो ठीक इन्वेस्टिगेशन भी करना है। ठीक है सर। सो रमेश जी, मैं आपको मैसेज भेजा है, मैंने मेरा नंबर भेजा है, फिर व्हाट्सएप में बात कर सकते हैं। ठीक है?
ओके सर, थैंक यू।
Okay, thank you very much for coming. Next question is, Bhanumati, can absent seizure convert to grand mal? Yes, it can. Absent seizure may be a beginning. There are some syndromes. Syndrome means there are some types of conditions where there are multiple episodes of epilepsy happening in the same individual. For example, let's say juvenile myoclonic epilepsy. Juvenile meaning teenage, myoclonic means sudden jerks like this. Simple, one off. ऐसा होता है. Myo means muscle, clonic means like this. Myoclonic seizure. But that person can also present with absence epilepsy, then he can develop generalized seizures, and then he can also have myoclonic seizures. So it can change. Sanvi Kapoor, sir, you said no harm to brain if seizure is less than 5 minutes, but why child forgets things for a few days and then regains after some days? So what I mentioned is general rule, but there are, each child is different. Why is the child having seizure? That is very important. If there is an underlying problem, unless you treat it, seizure will continue, and seizure can cause brain damage, seizure can cause forgetfulness. It depends upon the underlying cause and how abnormal is the EG. EG कितना खराब है, उसके अनुसार आउटकम भी बदल सकता है। ठीक है? What can be the immediate management of epilepsy or epilepsy at home or setting for a layman? Ms. Anshika, I think I've shared a video. Please look into it. It tells you how to manage. Okay. Next question is from Pramarth. Sir, namaste. Can 5-month-old fetus get seizure inside the womb? Yes. Children or babies in the womb can also have seizures. Once again, those are the conditions where it means the brain is not well formed or the genetic problem is there. So we need to discuss what is there. Sanvi Kapoor, whether levetiracetam causes dryness? Yes, it can, but not always. You need to look why is your child's skin is dry. Is there any other reason? But generally, no. Most of the medicines can have this kind of non-specific side effects, but not as a rule. I think Mr. Ramesh, I have discussed. Can a 36-year-old woman having focal cortical dysplasia be pregnant? Yes, you can. But you need to consult two individuals. One is the neurologist and second is the gynecologist. The reason is before you conceive, before you even become pregnant, it is very important. Ms. Sonika Khanna, are you there online? Okay. So before you hello?
Yes, sir.
Okay. You understand English? You're okay with that?
Yeah.
Okay. Before you conceive, even before you become pregnant, you should get an advice from the neurologist to make sure this medicine is okay or not okay. Because some medicines are not good for developing fetus. Xenoxa or oxcarbazepine is good, but still it depends upon what is your underlying cause. I would discuss with your neurologist first. Then you take advice from your obstetrician. And also you need to take folic acid supplements even before you start planning for the baby. Because some of these medicines can reduce folic acid, which is very crucial for the brain development. So most of the brain development or the seeds of brain development are already laid even before you realize that you're pregnant. So it is very important you take those medicines and seek advice from neurologist and gynecologist before you conceive. Is it okay?
So but there's one more question that,
Go on.
yeah, there's one more query that I'm having. That I had been recognized with this focal cortical dysplasia and a lesion in brain. It was very small, which was not clear to anybody whether it is glioma or not.
Okay.
So it was so faded.
Yeah.
Okay. In 2018, further in hamare jab 3 tests, when I got my under 3 Tesla MRI along with contrast, so the report was saying that it was actually of the size that it was measured in size, and the report just a second. So the thing was this ki jo report thi meri usme us samay tak there was no change, but suddenly there is a spurt in the change in the last 3 years, and my latest report suggests that it is 3 times bigger in size.
So somebody said it resolved and then it has come back.
It was actually controlled and stagnant at that time, but suddenly it has a spurt up. It's you can say the growth.
Okay, can I ask you where are you calling from, Ms.?
The growth has I'm from Lucknow.
Okay, I think what I would advise is you please get in touch, share your image reports, and we can discuss it later. Because it is surprising it got bigger and smaller. That doesn't usually happen. Maybe the imaging was not correct.
Yeah. So your contact number, should I contact on that?
Yeah. I am sharing you my number on your direct message.
Okay, sir.
Thank you. Okay, next question was from, one second. Okay, if an autistic child, what should be done? If the child gets, autistic child gets seizure, the management is same, no different. So Akanksha Saxena, sir, video is only in Kannada language. I know it was made for local, because I practice in Karnataka, I go to a lot of rural areas, but there are English subtitles. Many of them are quite evident. Please have a look. I hope we'll do it again in Hindi. Sujata, my son 6-year-old was diagnosed with epilepsy a couple of weeks ago. EEG performed. I was asked to stay still, which he was, but most of it kept moving. Does it impact the EEG report? See, generally, children are very difficult. You cannot expect a 6-year-old to stay still for 30 minutes. They will move, but when they move, it will give rise to what we call it as artifacts. On the EEG, we can make out what is abnormal electrical activity and what is artifacts. But sometimes the child is so disturbed that you cannot get any good recording. If that is the case, your doctor will advise you to repeat it. So it is okay. When the child moves, we can make out what are the movements and what are abnormal activities. Okay. Sanvi Kapoor, midazolam spray, how many times can we give? Please ask your doctor. It depends upon the age and the weight of the child. Also, he's asked me to take Alchrono, superactive. Hyperactivity, is it a sign of epilepsy? Not always, but sometimes post-epilepsy children are hyperactive. Okay. What should be one state of mind while a person is having epilepsy? Like as epilepsy-related psychology, but I don't allow epilepsy to grab me psychologically. Okay. So children, especially teenagers or people with epilepsy, are at a higher risk of depression, psychological issues. If you have any of those concerns, please speak to your doctor and get the right help, because you can lead a normal life. Okay, before I finish, I hope not many people drop off. I'll give you all a quick assignment. So you should all do it yourself rather than me saying, because it will change your perspective of epilepsy. Just hang on there. So Shaheen Abdullah, once again, you're asking 11-year-old daughter on Triaptol, can she take Pfizer vaccine? Any vaccine is fine, but at this moment, it is not authorized for 11-year-old. It's about a next question is from Sangeeta. I have a question. Family friend is basically 30 years, having epilepsy. There is no epilepsy recently. Okay, so basically it looks like long-term epilepsy, and the individual seems to be having low learning difficulties. So it is very important you speak to an adult neurologist or seek help from somebody who can help you to lead an independent life. Dr. Madhu. Who is Dr. Madhu or Sanvi Kapoor? Can epilepsy be cured permanently in a person aged 45 who has been on medication since age 12? Okay, Umaywan, are you there? Umaywan. Hello? Okay.
Yes, sir. Good evening.
Good evening, ma'am. I think your question was, can a person who is on medication since 12 years, can they be seizure free? So yeah. Is that what you wanted to ask?
Yes, sir. Yes, sir.
So the answer is, once again, depends on what is the cause. And secondly, if you have been on medicine for 12 years, is a person seizure free?
Actually, sir, he was having it since 12 years. Now he is around 45 years. And recently, around 6 months back, he had an episode of seizures. So is there a permanent cure for it? Is what I want to know.
When was the last seizure?
Around 6 to 8 months back, sir.
6 to 8 months back. So we need to ask, what is the cause? Unless we know a cause, it is difficult to give you an advice.
Okay, sir. Okay. Sir, can I get your number? Can I call you, sir, with his reports and all? Can I contact you?
Okay, ma'am. I'll send you my WhatsApp number. You can get in touch, then we can discuss. Okay. Or I think I posted my social media links, handles, and everything. There's a number there, which is my secretary's. You can also reach out there.
Okay. Thank you, sir.
Thank you, ma'am. Next question is from Bhanumati. Sir, deficiency of folic acid and iron in early pregnancy, is it the reason for juvenile epilepsy? No. Generally, no. Iron deficiency does not cause epilepsy, but it will only increase the chance of seizure. Hello? Can you hear me?
Yes, sir.
Okay, so that is the answer for it. 1 second. There are a few other people who have raised your hands. I will come back to you. 1 second, please hold on. So what I wanted to say to everyone is, I think I've gone through the list of questions in the chat box, and I'll start asking questions from people who have raised their hands. If you're still there. Important thing to remember is if we all get together, then we can make a difference with respect to epilepsy management. Epilepsy management is easier, but the stigma and the misconception that is there in the parents and the public is very difficult to treat, even for the best of the doctors. So there are a lot of information I share on blogs or Facebook or social media. You can always join. You can also check out my website, which will give you some more information about a lot of other health issues. Okay, now Meena Gupta, madam, are you there? Meena Gupta, are you there?
Yeah, good evening, sir.
Good evening, ma'am. Please tell me what's your question.
Sir, I wanted to talk about epilepsy management. You have already answered about it. Thank you so much.
Thank you very much. Thank you for coming.
Thank you, sir. Thank you, sir.
Momita Ghosh. Momita Ghosh, I think you're there.
Ma'am, you can unmute yourself. I think she's not there.
Okay.
Yeah.
Okay, next one is Sujata. Sujata.
Thank you. Yeah. Good evening, doctor.
Please go on. Please ask your question.
Thank you so much for this opportunity. For someone who has recently, facing this, so it's a great opportunity to discuss and inhibition. So thank you so much, sir. We have already answered a few of my questions. So how did I go to the doctor? He just had this sudden jerks. It just lasts a millisecond where he will throw his hands and legs like that's all that happened. So, and it's been happening for almost a year now since we had these online classes, a lot of stress with these classes. So I never thought it was something, it could be that big. But then I thought, okay, let's go to the doctor and see what is causing these jerks. He suggested an EEG, and he was not given any medication. I was asked if he should be given a medicine before the EEG. Will he move or will he, stay still? I said he will listen to us and he will stay still. But during the entire EEG, he was moving. As much as he wanted to stay still, he would just keep moving his hands and legs. So I was worried if if that shows any different in the EEG, will that impact the EEG report? But you said it won't.
Okay. See, once again, it depends upon the quality of recording and how long the recording was done. If say, let's say your boy was still for 5 minutes and it showed some abnormality during that time, and let's say another 5 minutes, he was just moving around. When I see the graph, I can differentiate, okay, this is because of movement, this is because of natural abnormality. That differentiation can happen. Sometimes the child is moving throughout to such an extent the abnormality and the movement artifact overlap, and it may not be possible to differentiate. That is also possible. In such cases, if I had seen your child, I would have said, please repeat the EEG.
Yeah, the technician would stop recording, then she will start recording. The whole thing happened for 20 minutes. For a layman like me, I would not know what's right. But she kept just stopping and re-recording. I'm sure the doctor would have.
I hope so. Yeah. Where are you from? Where are you calling from?
I'm from Nellore, Andhra Pradesh.
Andhra Pradesh. Okay, ma'am.
Yeah, so, and then so the report was there, and for the last 2 weeks, it's been 2 weeks that I'm giving him Alchrono CR200. I haven't seen those jerks.
Good.
I don't see that. But to term that as a seizure for me as a parent, it's been a very difficult 2 weeks so far. I don't know. I only heard about them in movies, or I've seen them in the movies, but having your child go through that, it's really, really tough. So I'm
okay. How old is your child?
Way to his recovery. I don't know.
How old is your child?
He's 6-year-old, doctor.
6-year-old. Okay. Is he otherwise well, developing normally, education-wise normal?
There is an attention problem. Not always, when I call him out, he will not listen to me. But then everything is going on in mind, and he recollects very well, doctor. He has a very good recollecting power, memory to say. But I wouldn't say that he will pay attention to every detail. And after the medicines, he's a very hyperactive. For the past 3 years, otherwise he was a very silent kid. But for the past 2 years, he has been very active. Even the doctor said that this is not normal. He's very active, and this is a sign of epilepsy. I don't know what he meant when he said that. And nowadays he's become very, he's normal. He's moving around. He's reading. Everything is doing, but he screams and he shouts on top of his voice, and he's moving around. His hands and legs are as I said, is very hyperactive. He doesn't want to stay still even for a second.
Okay.
So I want to know if all of these are signs of whatever you mentioned, like epilepsy.
Not everything is epilepsy, but sometimes we see children with epilepsy also have other behavioral issues like hyperactivity, inattention, learning issues. So it is more than what meets the eye. It may be just the two different things are there possible. Second thing is we see very commonly these days, especially for last 18 months, children are more hyperactive, more restless, mainly because they've been all locked up. They have lost the normal day-to-day pattern, ability to go out and play, ability to mingle with children, family, functions, nothing is there. So we do see a lot of children with behavioral issues.
True, doctor. Well, that's what I'm unable to differentiate now whether whatever he's doing, is it behavioral or is it something that is triggered by his mind because what he's going through. So it's very difficult for me to make people around understand why he is doing what he's doing. So I'm not able to, differentiate what it is. Sometimes I'm mellow down and it's like, okay, this is not something in his control. But then I have to also make him understand that you cannot do this or you have to behave in a certain way. I don't know how to do that, doctor.
Was this issue there before the seizure happened?
I mean, this has been happening for almost a year now. So seizure, even just a jerk, I don't know, is that So that's called a seizure, right? So yeah, it's been there before, but it's increasing. I can see that, you know, he doesn't listen to me now. You know, he answers me back. I can see that now. So I don't know.
Okay.
I don't know how to differentiate that, doctor.
Fine. Did they say the diagnosis was myoclonic epilepsy?
I'm sorry, doctor.
What did they say? Did the doctor tell you that your boy has myoclonic epilepsy?
He said he has epilepsy. I don't, the other word he used, I don't remember he using that. He saw the EEG report, he heard what I said, and then he said that he has epilepsy. He has to be on medication for minimum 5 years. Another appointment after 3 months. That's all, doctor.
Are you in Kurnool or Nellore? Sorry.
Nellore.
I don't think there is any pediatric neurologist there.
The one I went to, he was a pediatric neurologist. Yeah.
Okay. So generally what we say is 2 years of medicine for 2 years of seizure freedom, which we have repeated again and again. I would not say 3 years. And many times child with ADHD, you might have had ADHD already. So my advice is to meet a developmental expert or a pediatric neurologist. I've just posted a message to you on the chat box. Please have a look. Sure, and if you have any question, you can always reach out to me through my social handle.
Sure, that's very kind of you. Thank you so much. Doctor.
Thank you, ma'am. Thank you. Next one is from Bhupat Vishwakarma. I hope you're still there, sir. Mr. Bhupat? Okay, I think that's it. Anybody else has any other questions? Okay, I think that's it, Rajesh. Looks like we have covered all the questions that has been asked in the chat box.
Yes, doctor. So thanks for your valuable time and for the wonderful session that you have addressed the crowd. So really that was a great session, and thanks for the support, and for all the participants, those who participated in this webinar. So thanks for your participation over here. So so look forward to have such more sessions along with you, doctor.
Thank you, ma'am. Thank you very much.
Thank you.
Thank you, everyone. Thank you for your time.